This microphone seems to want to pick up everything besides me, but we're going to give this a go anyhow. Filming just outside the job site here, so gotta keep my PPE on. But I wanted to talk to you all about knees. So real quick disclaimer, if you have like sharp or burning pain in your knees when you're walking, standing, trying to do exercises, things like that, that's an indication of an injury or something else going on that needs medical attention. If it's just kind of a dull ache or just feeling kind of stiff, like when you're trying to do squats or lunges or something like that, that's what we're trying to address here. So in my experience with martial arts, we did a lot of lower body flexibility, and I think that's helped me a lot with my knees. Doing some research onto knee pain, one of the main causes of knee pain is actually a hip flexor misalignment or weakness, which can happen if you're sitting a lot. Most of us sit a lot. I know I do. I drive a lot. So I got to make a special effort to make sure that I'm hitting the hip flexors, which start up here, they wrap around the hips and terminate right about waist level there. That's how the top part of your leg moves. So we're going to run through a quick routine here. Take this at your pace. Stay within your limits of range of motion, anything like that. But we're going to go ahead and start with warming up and stretching these hip flexors here. So we're going to come up, go ahead and hold on to something if you need to. We're going to bring this leg out as far as you can here and then back down. Do the other side, same thing. All right. Try and keep yourself facing forward as much as possible while you're working those hip flexors. See, my right moves a lot easier than my left does. So even I have some imbalance there. So we're going to do this we're going to go for about 10 sides each, 10 times each side, which I've already lost count. So we'll do one more round of these and call it 10. All right, so there's 10. Oops. See? Imbalanced hip flexors cause all kinds of problems. Okay, so next we're going to do what's called a horse stance. So your feet are going to be about twice shoulder width, 1.5 if you need to. We're going to sit down as low as you can. Make sure your toes are facing forward. All right. And with this, I know not everybody's going to be able to do this for a long time, but try to work up to a minute is a good benchmark for this exercise. What it's going to do is put that terminology, time under tension on your tendons, your ligaments here. So muscles are a bunch of little fibers that all interconnect. So a muscle is not just one monolithic organ. It's a bunch of little fibers, which is why when you massage it and push it around, it can be kind of squishy, but then when you tighten it, it becomes hard. So all those little fibers in there, as you exercise, those can tear, but they rebuild very quickly. That's how bodybuilders, power lifters get such big muscles, because every time one of those muscle fibers tears, it grows back a little bit bigger. Tendons, not so much. They're more like a rubber band. They're designed to be a little bit stretchy, but if they tear, it usually tears all the way through, which is why I said at the beginning, disclaimer, burning or stabbing pain needs to be taken care of by a doctor. That's usually an indication of soft tissue damage. Now, the reason we're doing a horse stance and not a wall sit is, again, these hip flexors here. With your feet more than shoulder width apart, you're engaging those hip flexors also. It's helping keep your core stable, everything like that. So once you've been able to work up to about a minute of horse stance, or even to help you work up to that, there's another couple exercises that we're going to do. These are stability exercises. So first is a boxer's, what we call a boxer's squat. So feet are going to be about shoulder width apart. Now, we're going to come down, and we're going to move to our left, and move to our right. All right? So left, right, just like a boxer. Okay? And this is going to change the angle that your knees and your hips are having to support your body on. So try to do that for about a minute. Next, we're going to do, let's see, horse stance, boxer squats, and then the last one I'm going to show you all is the single leg body weight deadlift. So single leg body weight deadlift. So what it is really is just coming down on one leg, trying to keep it as straight as possible, keeping your other leg out behind you as much as you can. Come down, touch the ground in front of you, and come back up. It's going to work those hip flexors and work on that knee stability. So down, come up, and again, try to go about a minute on this, nice and slow, nice and easy. You don't want to go fast, and you especially don't want to do this loaded, having a load, a weight of some kind, if you are experiencing pain and stiffness and things like that in your joints. So just body weight. Now, if that's a little too much for you, there is also the staggered step. So instead of this leg coming up off the ground, it's going to stay on the ground as we reach for the ground, come back up, switch legs, come down, come up. So that's a modification there. And if you notice, that's kind of a lunge position there too. So if you're having trouble with your lunges, specifically, that might be a good one to start with. So I'm going to go ahead and put all these exercises into a short also, but I want to give you all the long form explanation of everything here. Apologize, it's a little bit rambly. Yeah, that's it for today's knee and hip stability